Welcome to Ballot Battleground, Nevada. I'm your host, Ben Margiott, a reporter at KRNV News 4 in Reno. I'm passionate about making politics in this critical battleground state more digestible to the average voter and pushing past the talking points to press politicians for answers. On this show, we take deep dives into the people, ideas, and debates shaping Silver State politics. President Donald Trump's signature economic package, the One Big Beautiful Bill Act, is now the law of the land. The sweeping legislation narrowly passed with only Republican support in Congress and was signed into law last week. It does a lot, like making the Trump tax cuts enacted in his first term permanent, ending the federal income tax on tips for a few years, and substantially increasing defense and border security spending. It also raises the debt by $4 trillion and makes drastic cuts to healthcare spending and food assistance. It's expected it will cause 12 million people to lose coverage through Medicaid or the Affordable Care Act in the next decade. And in that same time, there will be $186 billion in food assistance cuts. How will these cuts affect Nevadans? This week, we've got two guests who can speak directly to the real impact of these cuts in the Silver State. First, we'll talk to Mandi Larsen. She's the Chief Development Officer with Northern Nevada Hopes, one of the biggest community health centers that serves a huge portion of patients on Medicaid. Then, a little later, we'll hear from Jocelyn Lantrip, the Marketing Director for the Food Bank of Northern Nevada. She'll tell us how cuts to the nation's food stamp program could contribute to food insecurity. But first, Mandi Larsen with Northern Nevada Hopes. And joining me now is Mandi Larsen, the Chief Development Officer with Northern Nevada Hopes. Mandi, thank you so much for being here and making the time. We appreciate it.
Thanks for having me, Ben.
Yeah. When did you start with Northern Nevada Hopes? How come you wanted to work for a community health center?
I started working for Hopes about 6 years ago. I worked for a large national nonprofit, always had an interest in public health. And candidly, my family is very, very tied to the work of Hopes. My little brother is alive because of the work that we do. So easy to
Wow.
get to work every day. Yeah.
Do you mind sharing me what happened in that instance?
Yeah, absolutely. So my brother, who is my ride or die, we're 18 months apart. He struggled with substance use issues in his early 20s and ended up having a pretty serious alcohol issue. A few years ago, he was looking for some help. He was ready, and our medication-assisted treatment program at Hopes was able to get him in and truly save his life. He credits Hopes for saving his life. Yeah.
Wow. And there are so many stories like that across Northern Nevada because you guys serve so many people. Remind me how many people you guys serve, and you know, for people who might not know, what is a community health center? Where are you guys? How many people you guys serve each year?
Absolutely. So Community Health Center are tasked with making sure that all of our neighbors, all of them, have the healthcare access that they need. Northern Nevada Hopes has a pretty large footprint in downtown Reno. Our main campus is on 5th Street, 5th and Ralston, and we just opened a brand new clinic about a year ago on 4th Street. Between those two campuses, we're serving over 22,000 individuals a year, and that's seniors, children, families, people experiencing homelessness, the whole gamut.
Wow. And what is the kind of breakdown of insurance? Are people paying privately? How many people are on Medicaid, which of course we're going to get into today? What's the kind of breakdown of your clients?
Yeah, absolutely. You know, federally qualified health centers, community health centers, same thing, one and the same there. Our best payer is Medicaid. It's how our program was built back in the 1960s in this country. And so the way our business model works is Medicaid represents about 34% of the population I was just telling you about, and they are our best payer. That's how the business model is set up.
Yeah. And what about actual direct funding for Northern Nevada Hopes? Is a lot of your funding coming from Medicaid as well?
Yes, absolutely. A huge portion of our annual $60 million revenue comes from Medicaid, as well as governmental funding and other pieces.
Gotcha. Obviously, you don't work for Medicaid, but just briefly tell me how people qualify, how people sign up, what kind of steps go into someone getting on Medicaid. Take me through that.
Yeah, absolutely. So at Hopes and at a lot of federally qualified health centers across the country, we are always in lockstep with our patients that are coming in to help them get enrolled in Medicaid. So when you walk into Hopes' building, the first question we're going to ask is, do you have insurance? And then we're going to help you with a Medicaid roller by our side to find out if you're qualified. And we take you through that process, which those listening may know is pretty cumbersome, even for highly literate folks. And so we have navigators, if you will, that walk alongside our patients to ensure that they see if they're eligible.
We do, and it's based on income, right? So is it an amount of benefit that you get based on your income, or just you qualify or you don't, and then you get the benefit or not?
Yes. So there are levels based on your income. So pieces of those are calculated based on the federal poverty level, Ben. And so based on where your income, you're going to qualify for Medicaid at a level that represents your income.
Gotcha. And let's clear something up, because there is a misnomer out there, this belief that there are a lot of undocumented immigrants that are getting Medicaid benefits, and that this one big beautiful bill act, which we're going to talk about, is rooting out the waste and the fraud and the abuse. And we see it in the Facebook comments. The undocumented folks that are supposedly getting Medicaid, a lot of people would say, can they get Medicaid benefits? And the answer is no, right? But what are the steps in place to prevent that?
Yeah, in general, undocumented immigrants are not eligible for Medicaid. Period. There are some instances where emergency Medicaid may come into place. They might receive care through community health centers like Hopes, and we serve patients regardless of their ability to pay, regardless of their immigration status, regardless of their insurance coverage.
Thank you for providing some of the background and the context for that. We appreciate it. How exactly, now that the One Big Beautiful Bill Act has been passed, it's been signed into law, we're not talking hypothetically here, these are cuts that are going to be happening. How exactly are they structured? My understanding is it's primarily has to do with work requirements. Walk me through what kind of requirements are in place now, and really what kind of reporting requirements, because I think that's the big difference, right? Is just additional reporting that will be taking effect here in the next few years.
Yeah, absolutely. And like you said before, I'm not a Medicaid expert,
Sure,
but
yes.
I can speak from Northern Nevada Hopes' lens. So currently, I let you know, you can get on the Medicaid site and you can walk through that enrollment and you can fill out that paperwork and you can understand if you're eligible or not. Fast forward to the changes that are coming, Ben, a couple of pieces. The first is, I believe the feds are looking at capping federal Medicaid funding. So that could be through block grants or looking at per capita limits, which obviously is concerning in and of itself. The second piece of that is reducing eligibility and benefits. The third piece of that is exactly what you just hit on, which is the imposing the work requirements. That is completely new for us. And as you know, a lot of the folks on Medicaid, I think in particular of single working mothers, that may be deeply affected by these work requirements and those pieces. And those are set to go into effect at the end of the year, December 31st. Okay. But I believe that, again, I'm not a Medicaid expert. I believe there will be an option for states to take a look at wanting to be granted an extension for that. I don't know if the state of Nevada is looking into that at this point or not, but these will take effect at the end of the year. And the tidal wave of paperwork and eligibility and re-eligibility and all of that certainly will have an effect on our population.
Yeah. You will hear the argument from supporters of this legislation, Republicans, saying, what is so bad about asking people to work 80 hours a month or volunteer or do community service in order to qualify for this benefit? How would you respond to that?
I think there's a couple of pieces at play. One, you're talking about human lives, and for us to make sweeping judgments about what's going to work for the majority of the country, that's hard because even when we open our doors every morning, Ben, the differences of people on Medicaid, you can imagine, range greatly. And so to me, healthcare is a human right, and we should be making sure that we're meeting people where they're at. And looking at what's possible. Now, the work requirement in and of itself, some may argue is good, some may argue is bad. For us, when we look at it internally, and we already understand the burdensome system that Medicaid is, this is going to put additional obstacles in that place where somebody might have Medicaid day 1 of a month, but on day 30 they don't. And so that re-eligibility, the re-application, the ensuring that they're continue to be covered by Medicaid is one of the biggest issues we're looking at on the work requirement piece.
Yeah, how is it that people kind of fall through the cracks, so to speak? And obviously we haven't had these requirements here in Nevada, but in other states they have had them. Is it just too much paperwork for a lot of people? And we should point out too, in a lot of instances, people are already working, right? A good portion of people are already employed,
Yes.
and then just not doing the paperwork?
Yes. A lot of folks on Medicaid are already employed. It's so beautiful that you said that, because that's something important for us to understand, that folks who receive Medicaid often are already employed. What we think might happen is, yes, I think these new regulations, they're going to be confusing. There's going to be inaccessible reporting systems. The systems are going to be overwhelmed right from the jump, because so many people are going to be trying to navigate all of that new language. Of course, there are things like unstable work hours that won't meet the requirement. There are language barriers. There are folks with disabilities, all of those things to be considered within this.
Yeah. The estimates vary. We did a story on a report last week that said 114,000 Nevadans could lose their health insurance. I think the Kaiser Family Foundation study was around 80 or 90,000. Regardless, it's tens of thousands of people anticipated to lose coverage in the next few years as these cuts really start to take effect. What does that mean for you guys, for Northern Nevada Hopes? Could you continue to serve people at the level that you do now if you lost a significant portion of your clients?
Very directly, no. Our entire business model is changing real time. I think the last stat I saw in terms of community health centers, 41% of community health centers are going to close when these happen. So you can imagine there are several really wonderful community health centers across our state. Hopes, of course, being one of them. So for us, we're looking at a few things, Ben. First is, how do we pivot? How do we pivot to meet the moment? How do we take a look at our business model to ensure that what we are anticipating is a tidal wave of uncompensated care, how we can get to the table and continue to serve those? Because what I can tell you about Northern Nevada Hopes is we are not going away. We are going to meet this moment, and we are going to figure out one way or the other how we can continue to serve the patients who need us, not just the 22,000 patients who need us right now, but the tens of thousands of patients who are going to need us in the next few years. And
I think you mentioned a key point, right, which is uncompensated care. It's not that folks will not stop showing up at the doctor's office, right? It's just that you guys will still serve them, and then have to figure out on the back end how to pay for that care.
Exactly. I appreciate what you're saying, because I've there's of course two sides to this story. And I've heard folks say, well, I'm not on Medicaid, this doesn't affect me. Yes, it does. The tidal wave that's coming for our healthcare system with these changes are going to be great. When you and I need to get into that ER, or our kiddos need to be seen by a doctor or whatever, the entire system, I believe, is going to be completely overwhelmed. So not only is Hope's going to need to work to keep our care open, but the way you and I consume healthcare right now, the way our kids consume healthcare, the way our parents consume healthcare, we got changes coming.
Yeah. I like what you said about, Northern Nevada Hopes is going to meet this moment. There's going to be community health centers all around the country trying to grapple with kind of what comes next over the few years. We've seen estimates of rural hospitals having to close. And, one thing too is people delaying care, right? It's the preventative care. They're coming in for regular appointments for whatever ailment they have. And those appointments might be skipped, and they're ending up more likely in the emergency room. I mean, I don't know, what are some of the other ramifications of this?
I think the provider shortage is going to continue to be an issue for us. I think, we're talking about how this is going to stress our patients. we're not talking about how this is going to stress our doctors, our medical assistants, our nurses, our pharmacists. I think it's going to be a time where we're going to need to rally around our docs and our medical providers and our first line responders. And all of that said, this is going to be a great opportunity for us to come together as a community and understand what the ramifications will be locally, but also how we can help combat it and how we can work together to meet the moment. Because, if anything, Reno is resilient, and we're in this together.
Yeah. We'll leave it there for today. Mandi Larsen, the Chief Development Officer with Northern Nevada Hopes. Appreciate you giving us some insight and some expertise into a convoluted and sometimes complicated subject. Thank you so much for coming in.
Thanks for the opportunity, Ben.
Next up, how the cuts will affect the ongoing fight against hunger in a state already towards the bottom for food insecurity. Joining me now is Jocelyn Lantrip, the Marketing Director of the Food Bank of Northern Nevada. Jocelyn, thank you so much for being here. I really appreciate it.
Thank you for having me. I'm excited to be here.
Yeah. You've been with the Food Bank for how many years now? It's been a minute.
16 years.
Oh my gosh.
Might be dating myself a little with that. But when I got to the food bank, I figured out this was the place I was supposed to be. I really do love it.
Yeah. Why are you passionate about solving food insecurity?
It's so basic, really. People need food to live. It's a basic need, and a lot of people have struggled to put food on the table, so that's important to me, and definitely easy to sell the need for that.
No doubt. Give me a sense for kind of from a 30,000-foot view here of the programs that you guys offer briefly, how you help people get their SNAP benefits, which we will get into, but also the food bank itself and how many people you serve every month, all that good stuff.
Sure. The food bank is larger than you think. We serve 90,000 square miles.
Wow.
So that's all of Northern Nevada, but it's also a little slice of California, Northern California on the eastern slope of the Sierra. It's really easier for us to get food over to those communities than the California food banks. So we
Makes
do
sense.
that
Yeah.
in partnership with Feeding America. So big service area. We distribute food through a partner agency network. So it's about 150 plus partner agencies. Those are churches, low-income daycares, rehab centers, all kinds of nonprofits that need food for who they're serving. And then we also do direct service programs like Mobile Harvest, Produce on Wheels for seniors. We do SNAP outreach, some nutrition education, and all kinds of stuff. So
Wow.
We're busy. We're helping 160,000 people every single month.
Wow.
That is absolutely a record for the organization in its 42nd year. And last year we distributed about 21 million meals, and it's gone up. That is our last fiscal year. We just finished a fiscal year. I don't have all the numbers in, but I can tell you it absolutely went up.
Yeah, those numbers, when I was doing some research for this episode, I was just staggered to see the amount of people that you guys serve every month. And then when you include now, as we zoom out to look at food insecurity generally, all the people that are on SNAP, the Supplemental Nutrition Assistance Program, it's like 1 in 6 Nevadans is a stat that I saw.
Yes.
Over 500,000 people in Nevada.
It's a lot of people. It's a lot of people. If you think 1 in 6 of every Nevadan is relying on those benefits to help supplement their food budget and get food on the table for their families.
How does SNAP work in simple terms? How do you qualify? Who qualifies? How do you actually use it in the grocery store?
It's obviously a federal program, so there's a lot to do to qualify for it. It's an 8-page application, and you need to fill that out. You also need to do an in-person interview. As a trusted partner partner with the state. We do that interview for people in our SNAP outreach program. So we kind of help that process along because it is pretty difficult. So we help people get connected with SNAP benefits. Then you get an EBT card in the mail, and you take that to the store and spend it on food.
Pretty straightforward. Let's clear up some misinformation or a misunderstanding about the program, because what we see when we have posted about the impact of the One Big Beautiful Bill on SNAP and other programs is that they're just cutting down on all the undocumented immigrants that are taking advantage of these programs. Let's just ask it real plainly here. Can you get SNAP benefits if you're undocumented?
You cannot. This is a program for people who are citizens. You have to be a citizen of the United States to get SNAP. So that really isn't an issue. When you look at the fraud numbers also for SNAP, it's less than 1%. So that isn't what's going to happen with these cuts.
Yeah. Do you need to, I assume, on that 8-page application, probably verify your citizenship, or what's the step in place to prevent that?
You do have to verify citizenship, and so there's a lot that goes into getting those benefits, and so that really isn't an issue with this program.
Okay. So let's talk about the cuts. The One Big Beautiful Bill Act, which passed and was signed into law on the 4th of July, would reduce SNAP funding nationally by about $186 billion. I got that stat from Axios between now and 2034. That's a huge number. How exactly will those cuts play out? Does it have to do with more work requirements, or is it just putting more of the spending onto the states? How exactly are these cuts taking effect?
All of that, yes.
Okay.
So for the first time, this program is pushing down the budget down to the states in a significant way. That has never happened in all of the years of the program. So that's one way the cuts are happening. There's work requirements that are more stringent. There are really kind of different changes to SNAP, taking away the USDA's ability to evaluate the cost of food with the Thrifty Food Plan and adjust that for inflation or, changes in prices and cost of living. That is taken away in the bill. So we're really trying to dig in to see the timing of all of these changes because we don't fully have that information yet. But it is devastating to not only the food bank, but to our state.
I imagine the state of Nevada, as a lot of the costs are shifted to the state, it probably remains to be seen if the state can kind of pick up the bill, so to speak, to keep providing the same amount of SNAP benefits at the same level that the federal government's been paying at for many years now. The state of Nevada can't take on any debt. It's already kind of in a tougher financial situation. I mean, what are you guys anticipating in terms of how much the state will be able to cover the costs? Will they be able to fill that gap entirely or no?
We know that the state can't make up these costs. We just went through the legislature. We've seen what the budget is. We know how strapped the state budget is. And we were very fortunate to receive some money for the Home Feeds Nevada program in this last session, but the money is not there. And that's not just in Nevada. That's across the country. There are states all across our country who are trying to figure out how to pay for these cuts because SNAP is so important.
This stat that you've said in a previous interview, which just blew my mind, was that for every meal that you guys directly provide as the Food Bank of Northern Nevada, SNAP provides 9 meals.
Yes.
So it's a far larger program in terms of the amount of meals that are provided to people. What's going to happen to food banks, not just you guys, but around the country when SNAP benefits are reduced? Presumably a lot more people are going to be headed to you guys, right?
We see our increases in need at the end of the month already with SNAP because people will receive those benefits. The benefit is, an average benefit is about $6 a day for a person. And that is not a lot of money, especially in our current economy, to spend at the grocery store. So people are running out of those benefits towards the end of the month. That's when we see an uptick in people needing help. So we will see increases in people needing help. There is absolutely no way around that. Will we be able to keep up with it? I'm a little concerned about it. We will do everything we can. It may be people are receiving less food. We don't want that to happen. We're working very hard to get more food in the door and really more money in the door, make sure that we are ready for these changes. But it is a significant hit to hunger relief.
Is it your understanding, and I assume we're still all trying to figure out exactly how these cuts will take effect, but where entire families or people maybe can't jump through the additional reporting requirements and they fall out of SNAP completely? Or is it that $6 a day is decreased to a smaller amount and everyone on SNAP has a little bit less to use? Or how exactly will it work?
Most of the time, what happens if you are facing a stricter requirement is not a reduction in benefits. It's more you don't get the program anymore. So sometimes it will be the other way, but for the most part, people just don't get their benefit anymore. At $6 a day, it's hard to reduce it too much.
Right.
And so that's really what we see mostly.
When do the cuts start to take effect? When do you guys think you'll start to see more people coming to you guys?
We don't have that information exactly. We know that some of the parts of the bill will be happening right away. Some of them are over time. So we don't really know exactly how hard we're going to be hit and when that will happen. So we're really trying to figure that out right now as food banks across the country are doing the same. And we're very fortunate to be part of Feeding America because they do some national advocacy and really will help us figure that out.
I don't want to be too, hyperbolic and making it seem like millions and millions of people in America are going to go hungry. But is that what you think could happen with this? I mean, now that the bill is actually passed and is in law, and we're not talking about the potential of what could happen, but what is set to happen over the next few years.
Right. I truly wish we were talking about a hypothetical at this point because it is really serious. We are expecting this to affect hunger in the future. Food banks, as you said, the 1 meal to 9 meals, that we don't talk about that as much because we're talking about our work and what we do. And we distributed, our last fiscal year, it's looking like 28 million pounds of food. So that's significant.
Jeez, yeah.
But, and so you wonder how much more can we distribute? SNAP is really the most effective federal program for hunger relief, absolutely, in our country. And so to see it facing these types of cuts is, it's really upsetting. I would say that 62% of the families who receive SNAP in Nevada have kids. 41% are working. They're just not making enough money to pay their bills and buy food. So it's not what you think.
Yeah. And Nevada's already, as with healthcare and education and some other statistics, right? I mean, towards the bottom when it comes to food insecurity, right?
Yes, we do have pretty high food insecurity in this state. Our state was one of the last to recover from the recession. It was one of the last to recover from the impacts of COVID. So we need the support. And so we're really concerned about this.
Sure. Let's end on a more positive note,
yes,
though. Maybe there's a story or an anecdote or something positive that we could take necessarily from the bill, but just the work that you guys do. Share something with me to end on a lighter note.
Yes, please. Since I've been here at the food bank so long, I worked there during the recession and I worked there during COVID. And what I have seen is, and I'm sure this is true around the country, but our community is so helpful and so generous, and they really care. It got us through those things, and it will get us through this too.
Sure.
I know that we will be asking for help a lot in the next couple of years, but we appreciate it in advance because we know that this is a great place to live, and people are so generous and helpful.
Absolutely. That's a great place to end it. Thank you for bringing us back here to a call to action to our listeners and viewers to support the food bank. You know, we at News 4 and Fox 11 partner with the food bank a couple times a year, the big one being our Super Bowl of Caring around the time of the Super
Always
Bowl.
fun.
So you can do that. You can go directly to your website or bring food by.
You can bring food, and we have places to donate in town. You can volunteer.
Yeah.
We have volunteering all throughout the year. So there are a lot of ways to get involved. Advocate for federal nutrition programs is one with your representatives. This isn't over. So thanks for all your support and the support of the community, because without it, we wouldn't be here.
Great place to leave it. Jocelyn Lantrip, the marketing director of the Food Bank of Northern Nevada. Thanks so much for coming on Battleground Nevada. We appreciate it.
Thank you for having me.
A special thank you to Mandi and Jocelyn for coming on the pod this week. And if you want to read more of our coverage on the One Big Beautiful Bill Act, we've got links to stories from myself and my colleagues down in the show notes. Before we go, you've got about 10 more days to vote for Ballot Battleground Nevada in the Reno News and Review's annual Best of Northern Nevada Awards. This podcast was nominated for the Best Local Podcast category and has advanced to the final round. Voting runs through Sunday, July 20th. You can also vote for my TV station, KRNV News 4, for Best Local TV News, and Joe Hart, my colleague, for Best Local TV Anchor. We'll put the link down in the show notes. If you've enjoyed this show, if you've learned something, I would be honored to receive your vote. If you made it to the end of this episode, I really appreciate it. If you have guest ideas, episode ideas, questions, comments, compliments, concerns, anything at all, feel free to shoot me an email. I want to hear from you. It's bjmargiott, Margiott, at sbgtv.com, and put Ballot Battleground Nevada in the subject line. And if you have a minute, I'd really appreciate it if you left a rating and a review. That helps the podcast show up higher in searches so more people can discover the show. Thanks for listening.